Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is multiple choice questions on infectious disease epidemiology. 1. Which of the following is not considered an infectious disease? A. Influenza. B. Diabetes. C. Tuberculosis. D. Malaria. Answer: B. Diabetes. Infectious diseases are caused by pathogens such as bacteria, viruses, fungi, or parasites, whereas diabetes is a metabolic disorder. 2. What is the mode of transmission for the Ebola virus? A. Airborne. B. Vector-borne. C. Direct contact with bodily fluids. D. Foodborne. Answer: C. Direct contact with bodily fluids. Ebola is primarily transmitted through direct contact with infected bodily fluids like blood, vomit, or saliva. 3. Which of the following is an example of a vector-borne disease? A. Measles. B. Cholera. C. Lyme disease. D. Tuberculosis. Answer: C. Lyme disease. Lyme disease is transmitted to humans through the bite of infected black-legged ticks. 4. What is the role of a reservoir in the transmission of infectious diseases? A. It is a place where pathogens multiply and survive for long periods. B. It is the primary source of infection for humans. C. It is a measure of disease severity. D. It is a type of vector that carries the pathogens. Answer: A. It is a place where pathogens multiply and survive for long periods. Reservoirs can be humans, animals, or the environment. 5. Which of the following is an example of a nosocomial infection? A. Influenza contracted from a coworker. B. HIV transmission through sexual contact. C. Food poisoning caused by contaminated food. D. Surgical site infection acquired during a hospital stay. Answer: D. Surgical site infection acquired during a hospital stay. Nosocomial infections are acquired in healthcare settings. 6. What is the incubation period of a disease? A. The time between exposure to the pathogen and symptom onset. B. The duration of illness until recovery. C. The time it takes for a disease to spread in a population. D. The period when a disease is most contagious. Answer: A. The time between exposure to the pathogen and symptom onset. It can vary depending on the disease. 7. Which of the following is an example of a zoonotic disease? A. Chickenpox. B. Mumps. C. Rabies. D. Pneumonia. Answer: C. Rabies. Zoonotic diseases are transmitted from animals to humans, and rabies is one such example. 8. What is the reproductive number, R0, of a disease? A. The number of new cases in a given population over a specific time period. B. The number of deaths caused by a disease. C. The average number of secondary infections caused by one infected individual. D. The percentage of the population immune to a specific disease. Answer: C. The average number of secondary infections caused by one infected individual. It serves as an indicator of the disease's potential to spread. 9. Which of the following is an example of active immunity? A. Receiving a vaccine. B. Temporary protection through injected antibodies. C. Inherited immunity from mother to child. D. Exposure to a pathogen and subsequent recovery. Answer: A. Receiving a vaccine. Active immunity is acquired through exposure to a pathogen or vaccination, leading to an immune response. 10. Which of the following is a preventive measure for reducing the spread of infectious diseases? A. Quarantine. B. Antibiotic treatment. C. Symptomatic relief medication. D. Surgery. Answer: A. Quarantine. Quarantine helps isolate individuals who may have been exposed to an infectious disease, preventing further spread. 11. How does herd immunity work in preventing the spread of infectious diseases? A. It refers to the immunity of livestock animals against diseases. B. It is the resistance of a population to a particular disease due to a high percentage of immune individuals. C. It describes the immunity passed from mother to child during childbirth. D. It is the protective effect of personal hygiene practices against infections. Answer: B. It is the resistance of a population to a particular disease due to a high percentage of immune individuals. Herd immunity indirectly protects unvaccinated or susceptible individuals by reducing the spread of the disease. 12. Which of the following is not considered a primary prevention strategy for infectious diseases? A. Vaccination. B. Hand hygiene. C. Antibiotic treatment. D. Safe food handling practices. Answer: C. Antibiotic treatment. Antibiotics are mainly used for the treatment of bacterial infections, not as a primary prevention strategy. 13. Which of the following is an example of a waterborne disease? A. Dengue fever. B. Hepatitis A. C. Pneumonia. D. Measles. Answer: B. Hepatitis A. Hepatitis A can be transmitted through contaminated water or food. 14. What is the primary host for the malaria parasite? A. Humans. B. Mosquitoes. C. Dogs. D. Bats. Answer: B. Mosquitoes. Female Anopheles mosquitoes transmit the malaria parasite to humans through their bites. 15. What is the purpose of contact tracing during an infectious disease outbreak? A. To identify individuals with high disease severity. B. To determine the source of the outbreak. C. To develop new diagnostic tests. D. To locate individuals who may have been exposed to the disease. Answer: D. To locate individuals who may have been exposed to the disease. Contact tracing helps identify and notify potentially infected individuals to prevent further spread. 16. Which of the following is an example of an airborne disease? A. Cholera. B. HIV/AIDS. C. Measles. D. Tetanus. Answer: C. Measles. Measles virus can remain in the air for up to 2 hours after an infected person has left the area. 17. Which of the following is a personal protective measure against infectious diseases? A. Social distancing. B. Cough etiquette. C. Use of condoms. D. All of the above. Answer: D. All of the above. Social distancing, cough etiquette, and safe sex practices are personal protective measures to reduce the transmission of infectious diseases. 18. Which of the following diseases has been eradicated through vaccination efforts? A. Polio. B. Tuberculosis. C. Influenza. D. Hepatitis B. Answer: A. Polio. Polio has been eradicated in most countries through extensive vaccination campaigns. 19. Which of the following is a common symptom of infectious mononucleosis? A. Persistent cough. B. Swollen lymph nodes. C. Muscle weakness. D. Hypertension. Answer: B. Swollen lymph nodes. Infectious mononucleosis often results in swollen lymph nodes, along with other symptoms like fatigue and sore throat. 20. What is the basic reproductive rate, RO, of a disease? A. The total number of individuals infected during an outbreak. B. The average time it takes for an infected individual to recover. C. The measure of severity of the disease. D. The reproductive number under ideal conditions with no immunity. Answer: D. The reproductive number under ideal conditions with no immunity. RO represents the potential spread of a disease in a population without any immunity or interventions. 21. Which of the following diseases is transmitted through contaminated food or water? A. Tetanus. B. Legionnaire's disease. C. Typhoid fever. D. Dengue fever. Answer: C. Typhoid fever. Typhoid fever is